Hi everyone, thanks for joining in today on our live web session on Facebook. My name is Dr. Avais Pathan. I'm a consultant diabetologist and a metabolic physician working in South Mumbai. I'm the owner and primary consultant at Dr. Pathan's Diabetes Specialties Clinic, also the founder of Diabetes Specialties Clinic at Prince Ali Khan Hospital in Mesgaon. Thank you for joining. I hope you all are safe and healthy at home, probably having some chai and pakoras, looking at the weather outside. And I hope everyone at home is safe at home. We are going to talk about today, we have a lot to talk about, and we're going to talk about Unlock 1.0. Now, what I mean by this is we are now getting ready to step out and try to go back to a life which will be, so to say, a new normal life, because there will be a lot of new things that we will be doing to make sure that we are able to go out and not come back home contracting something. So we are going to have to behave and do certain things which we are not used to doing, and these will be new things that we will be doing. So hence I'm going to call it the new normal. And so discussions for today is regarding the Unlock 1.0. So I'm going to tell you today about the things to do, the do's and the don'ts basically. I'm going to show you how to wear a mask properly. I'm going to show you the different kinds of masks which are available. I'm going to show you how to sanitize your hands, how to wash your hands with soap and water, how to sanitize your hands properly. What are the precautions you should take if you're stepping out? What are the things you should do when you come back in to your house? What are the things, what is meant by social distancing and how to implement it at home, at your workplace, school, public areas, in lifts, how to behave in lifts. I know it's a second nature as to how we behave in public area, but now these things will change, and I'm going to have to tell you about how you are going to do that. Protocols to follow when it comes to simple things as your phone, what you are going to do with your phones, your keys, something that you use every day in your pocket at home, at work, and when you come back home, what you are supposed to and how you're supposed to deal with these things when you come back home, how to stay physically and mentally fit and healthy, how to boost your immunity, how to you can take some prescribed pills to make sure that you boost your immunity, and something very important which I don't think so people are touching on enough, that is how to stay mentally healthy and how to educate our kids regarding this pandemic, because you have to remember that the kids have been cooped up at home. They're not getting to go outside and play, they're not getting to go to school, meet their friends. So it's very important that for the mental health, well-being of your child, how to educate them regarding this current pandemic, and how to go about doing that is something I will touch upon. uh, and something very important is regarding patients with comorbidities like diabetic patients, cardiac patients, hypertensive patients, patients with chronic kidney disease, and their caregivers. What are the precautions that these people should be taking, and how do caregivers make sure that they are not some people who carry this and give it to their patients who they're giving care to. And so sit back, and I hope this is a session where you enjoy, and we will be putting up a lot of videos and posts on our other social media platforms, so at the end of this session, after the session ends, so that you can also see the videos about how to wear a mask and how to wash your hands and stuff like that. Will keep coming, so follow us over there so that you can get a good idea as to how this is going to happen. So as we unlock ourselves from the lockdown that we were in, going back to the new normal, and all of us go back to work and go to the market and stuff like that. So some of the things that you should know regarding hygiene and how to, you will have to have very high hygiene levels once you come back. So first I will like to talk about uh, going out. So suppose you are at home and now you've decided that you have to go out. Now, be it work or be it your you got to go make a run to the grocery or to the chemist shop or anything of that sort. So the first few things that you need to remember about going out is that you need to wear a mask before you go out. Now, which mask to wear and what not to do? Now, there are a lot of, I've seen a lot of patients who come into my OPD and my consultation, and I see them wearing these cloth masks which are made at home, and they are fine. All right, they are absolutely fine if you are not in close proximity to other people and not going into a crowded area, then that mask is fine. But if you are going into a crowded area, if you are going to be in a lift stuck with multiple people around, and if you're going to the office or the bazaar or the chemist shop where there'll be a lot of people around, then that mask is not good enough. Then you should have at least the minimum, most minimum thing that you should have is a surgical mask. I'm going to show you what a surgical mask is. This is a surgical mask, a 3-ply surgical mask. It has 3 layers inside, as you can see, and this is the most basic one that you can wear. These are things that go around your ear so that you can wear this mask, and this is the most minimum thing. So you have to know which side has this kind of a thing. So this is basically so that the mask goes tightly around your nose bridge, so that when you're breathing, the air that is coming in is only going through this mask, and when you're breathing out, it is only going through the mask. So it filters whatever is coming into your system. You wear it this way around your ear, and you can see right now this mask is not proper on me. What I need to do is pinch it over here. Very important, this pinching part, and make sure that this mask is tight around here. And I'm sorry, this is not a mask I wear because I have a beard. So if you have a beard, that's another issue, that you might not be able to cover it properly, because then there will be these gaps. So if you have a beard, there are other masks. I'll show you those masks. You can wear those masks and that'll be fine. And see, this is pinching this mask like this and wearing it tight. And if it's loose from here, you can tighten these masks. And if you can see, I'm going to turn around and try and show you this, that you can do this to it. You can pinch it over here at the back, and when you do that, what happens is this mask gets really tight, and you can see it's gotten tighter because I have done that behind. And you can put a clip or something over there, and this will become really tight. And now when I'm breathing, most of the air that I'm breathing comes out through the mask and filters from the mask, so you have lesser chances of breathing in something. The other masks which are available in the market are called N95 masks. This is one example of an N95 mask. This is another example of an N95 mask that you get in the market, and so is this is another example of an N95 mask. Now, N95 masks are very good masks. They filter a lot more, and their pores are much more stricter. So your chances of breathing in air which is not coming through the mask is much lesser. But it's not a compulsion. But if you are going by public transport like a bus or something of that sort, you have to take the bus to work, then I think so the N95 mask does do justice, and you can use that N95 mask. I know breathing from the mask might seem difficult, but you do get used to it. Trust me, you do get used to it. But you have to remember one thing, that you cannot do any strenuous activity when you are wearing this mask. You cannot, when you go for a walk, if you're going to go for a long walk and a fast brisk walk, then the mask should not be worn completely. because that is not good for you when you do that. So that is about mask. If you have questions, I can see there are people asking me questions right now, but I will answer them at the end of the session, so that we can have one continuous session and then we can answer in another session. The other thing that we need to do once we going out is sanitization, using alcohol based sanitizers. Now this is I have one here. I'm going to try to cover the company name because I don't want anyone. So this is one of the things that you use. These are alcohol based sanitizers. Now they come in a lot of forms, and basically some of them are gel form and some of them are liquid forms. Either of them is fine as long as they are alcohol based sanitizers, and you get very nice ones which are much smaller and pocket friendly, and you can carry them in your pocket, or they come with keychains where you can hang them in your keychains. Now these are some things that are must to have. As I said, the new normal. So this is one of the things which come under the new normal. You have to have these in your pocket or in your bag or whatever you are carrying, because every time you go out and you touch a surface, you don't know that surface has been sanitized by someone, and you don't know who's touched that surface. So it will be good if you can sanitize your hand, but don't do it every time you touch a surface, because that means you will be using too much of the alcohol based sanitizer, and that is not good for your skin. What you have to do is my next point, which is very important for me, for you guys to understand that when we go out, we touch our face nearly 3000 times. That is a problem. It's inherently built into our system that we keep touching our face here and there. I am touching mine, but don't worry, I have sanitized my hands so I can touch my face. But when we go out and we touch other surfaces, and then when we touch our hands, we put our hands on our face, our nose, our eyes, so that can be a problematic area. So we have to understand that once we go out, we keep our hands in front of us, and we do not keep touching our face for every small little things. People like to comb their hair all the time. If they have a beard, then the beard or the mustache is a very common thing with people who have big mustaches. It's a trend now to have those fancy mustaches. So when they keep doing this and doing this, so that is a bad idea. You should try to stop yourself from doing that. Touching your eyes. People who wear spectacles do that a lot. So we need to stop doing that. We need to realize that we do not need to touch our face, and if you do want to touch your face and you do have something that you have to take care of on your face, then make sure you sanitize your hand properly before you touch your face. That is one thing that I really wanted to get across, and it's really important, and I want you to understand this. And so yeah, this is some of the things. I will touch the topic of social distancing now when you go out, and I will touch it a little later. I want to get into other points, and then when we come to the point of social distancing, I will explain that more in detail. So the other thing that I wanted to talk about is information. That's the reason I'm doing this today, because I get a lot of patients, and they keep telling me some very weird things about the pandemic and about the COVID-19 and about the SARS-CoV-2, which is the name of the virus that is causing COVID-19. And the information is very wrong, what they have with them, unfortunately, and it's all got from these forwards on social media, which do not come from right sources. So I wanted to do this session today so that you have all the right information about social distancing and all the do's and don'ts about it from the right source. And so I wanted to tell you today that if you are going to search, so first of all, you need to get information, because that is most important. Get it from your doctor. That's the best place to get information from. Whoever is your physician, please make sure you ask him tons of questions and get all the right information from him. The other thing is getting it from the right news channels. Having said that, there are a lot of news channels out there who do give a lot of wrong information, so that's another problem that I have. But going to the websites of famous and very big institutes like the WHO, the ADA, the AACE, these are all institutes that are doing active research regarding the present pandemic, and they have guidelines which come out regularly, and these are very safe and the right websites that you can go and get your right information. Forwarding those forwards and all those are not the right place to get your information. So now we come to the matter with social distancing. Now, since I spoke about a person stepping out, so let's continue that story. And he has stepped out, and suppose he has a lift to enter, and what are the precautions to be taken when you are entering a lift, because that is another protocol that I want everyone to listen to and follow, because see, we have a lot of time with us now that we are not doing all the things that we did. So don't try to be in a hurry once you step out. Okay, I want to get my work done fast. I want to be the, because what happens is when that lift door opens and it's a good sized lift, and there are already two people in it standing on two adjacent angles, at least more than 5 feet apart from each other. You don't want to be the third person entering that lift and causing a crowd, and then what happens is social distancing is not maintained. So you rather let the lift go and make sure then you take it the next time when it comes. And if there is a lift man in the lift, then only one more person should be there, because two people in a lift is good enough. There should not be more than two people in a lift. So 3 to 4 and 5 is too much, too many people in the lift. The other thing is standing on adjacent angles in a lift, not staying too close to each other, is very important. The sneeze or cough protocol is another thing which is very important. If you do get a sneeze or you do get a cough, it is using your elbow in this particular manner to cough or sneeze is very important. And make sure that even if you're wearing a mask, do this, so that even from the sides of your mask, because of the air pressure, there is a chance that there's some air or something might come out. So if you cover it this way, that is a very good way, that is the right way to do it. So one person or maximum two people in a lift, if there is someone who is operating that lift, then one more person can be in the lift, but not more than that is what you have to make sure when you go out. So how do you maintain social distancing once you're out? So this person, as I told you, has entered the lift. Now he goes down and he's in the lobby area where there might be other people, and then he goes out from that and then into his car or whatever mode of, or bike or whatever mode of transportation. Then from there he is going for work, or he's either going to do some shopping. So social distancing, to maintain that gap between you and all the other people. So you have to do an imaginary 6 foot diameter around you and everybody else. So that bubble that you walk in is what you are meant to be in, and you have to keep that much gap from other people. Now when we stand in line for a bus, or we stand in line to make a payment for whatever thing we've gone out to buy, so you now it's very nice that all retail outlets have those circles marked on the ground. Make sure you stand in those to maintain social distancing from others when you are out in the open. Obviously, it goes without saying that you don't shake hands with others. Hugging is obviously out of the question. High fives and all of those is out of the question. Just a hello from far, or recognizing the person, saying hi, hello is fine, but not touching anybody and is very important. Now once you have stepped out, there are certain surfaces which are very important for you to understand. which are very high contact zones and very high infective zones, and places where you can get very easily infected from. And those are doorknobs, which you use to open and close doors. So whenever you enter a shop, or any facility, or like your office or anything, so the door handle or the door knob is a place where everybody is putting their hands on, and you don't know where their hands have been before. So that's a very high contact surface and a very high contamination surface for you to get infected from. The other things are when you're going into a bus, so the handle of the bus, and your own car, when you the outside surface when you open the door is another high contact surface. So there are a lot of these contact surfaces. As you go out, venture out, you will realize these surfaces, and these are very good sources of infection. So you got to make sure that you touch them the least. And if it's a two-way door, using your foot to open it from below would be a good idea if you can. If you can't do that, if it's not possible, it's a doorknob, then yes, go ahead and use it, but then make sure you sanitize your hands immediately after that, so that you do not have the contaminants on your hand anymore. This is the person going out and coming back, or going out. What about when we are at home? Do we do social distancing at home? Now, if you are living since lockdown with your family members, those people inside your house, then, and you've lived for so long together, then I don't think so any social distancing is required at home, and you don't need to do any of these things at home. But there are certain sanitation things that you can do, which I will talk about a little later, which you can do at home. Simple things, because there are again contact surfaces in your house and outside, like the doorknob to enter your house and stuff like that, that you can do. Make sure that you sanitize them on a regular basis. I will talk about that a little later. But the other thing is social distancing. I want to talk about at the workplace. We already spoke about shopping. Now I want to talk about the workplace. Now, at your workplace, there are different kinds of workplaces that people work in. One is the cubicle one, where everyone has a different cubicle, although it's just a cubicle and it's not, the ventilation is the same for everybody, they're sharing. The other thing, you have your own private office where you have your own private ventilation. That's the second thing. The third thing is there is no cubicle, and they're just open desks around, and people are working on their own individual desks. So I will approach this in three manners, in three parts. So first we'll talk about the people with their open desks and who do not have any cubicle to work in. So each desk has to be 6 feet from the others. That is something that you got to maintain. People who do not need to come into work should be allowed to work from home, and only if you need to go in, you can work from otherwise you can work from home. You should not work at your full capacity. I don't think so office people should call everyone to work every day. They can work at a 50% or a 30% strength, and call people on alternate days, so that you have less people at work, and social distancing can be maintained. Now, some of the things you utilize at work is your laptop, your iPad, your desktop, your phone. Phone is something that is there all the time. So you want to make sure that these things are sanitized. You can use the alcohol based sanitizer to sanitize these equipments, and it's not a problem. The other thing is, again, when you're working, do not when you're at work, do not keep touching your face, because you're touching all these high contact surface, high containment surfaces. So you do not want to touch anything after you have to touch the other surfaces at work. So do not touch yourself, and just after you finish work, after you finished your entire thing, then you can sanitize yourself. Otherwise, every minute sanitizing your hands with alcohol based sanitizer is not practical, not doable. Work related travel obviously should be put on a hold unless it's absolutely necessary. Food handling, food sharing at work. If you take a tiffin to work, please don't share your tiffin with someone else. It's not about being rude, but it's about not sharing food so that you limit your contact with other people. Make sure you eat your food at your own desk. If you have a cafeteria and uh, in your office, and if you go there for your meals, make sure that you are again sitting apart and not having a meal together. That's very important. It's very important to wash your hands with soap and water before you eat your meals. And again, in the work environment, sneezing the way I showed you earlier, or coughing, if you get a cough or a sneeze, then the way I showed you should be done, and it has to be done in that manner, and that's how it should be done. I think so. I've covered most of the topics where it comes to going to the work area.